Health Organization that the virus is spreading faster than it can be contained. Arthur Okiola reports.
Leaders from Guinea, Liberia, and Sierra Leone met the head of the World Health Organization to talk about how to handle the latest Ebola outbreak. Margaret Chan praised the leaders for recognizing the seriousness of the outbreak and vowing to take action, but warned that the virus was outpacing efforts to destroy it.
They agreed to focus special attention to the cross-border areas, where the three countries, meet. The common borders is an area which account for 70% of the Ebola cases.
Dozens of healthcare workers have been deployed in the Liberian capital of Monrovia for a massive disinfection operation at government offices. All schools were closed, and more quarantine measures such as restrictions on public gatherings and population movements are possible.
It's real, and we all need to take those precautionary measures that are being announced. Work with the medical people who are giving us the right pieces of advice. If we can do that, of course, it's going to help us to kick Ebola out of Liberia.
However, the scientist who discovered the deadly disease says the response to contain the outbreak hasn't been sufficient.
I think the response up to now has not been firm enough. And we should see also that this is happening against countries that are very poor, that have gone through civil war, decades of civil war sometimes, where there is a distrust in health services, in authorities, and that makes it particularly difficult to control this epidemic.
The highly infectious disease requires rigorous precautions to stop it spreading. More than 60 medical workers have lost their lives, hampering efforts to tackle the outbreak. Meanwhile, preparations are underway at a U.S. hospital to receive 2 American aid workers who were infected with the virus in Liberia.
We have a special containment unit which has been developed with the assistance of the subject experts at the Centers for Disease Control and Prevention. And together with them, we have developed a unit which can safely care for a patient with a serious communicable disease, delivering the highest level of care required, including intensive care unit.
The U.S. has pulled hundreds of aid workers out of the region due to the infections. Arthur Rukiola, ATV News.
Locally, Health Chief Koh Wing Man says getting travellers from West Africa to fill out health declaration forms is not feasible. Instead, the government will provide information on what to do if they develop Ebola symptoms. Edna Dare reports.
The recent outbreak of the Ebola virus in West Africa already claimed more than 700 lives, health authorities and warnings of possible cases in the city. Health Chief Koh Wing Man says the government will hand out advice to holders of passports from Guinea, Liberia and Sierra Leone upon arrival.
Essentially, the advice would direct them to present themselves to the Port Health Office if they have any symptoms on the point of arrival. And if they do not have any symptom at that time, then the advice would also let them know what to do if they subsequently develop the symptoms.
But Koh said it will not be feasible to require travellers arriving from the 3 affected countries to fill in health declaration forms, since there are no direct flights from West Africa. He added that the websites of the Security Bureau and Center for Health Protection will have messages warning people to avoid any unnecessary journeys to the affected countries. Meanwhile, an infectious disease expert believes the chances of a full-scale outbreak in Hong Kong are low, and the hospital authority is prepared to handle any cases that surface here.
We have to get ourselves prepared and be vigilant about the possibility for importation of such an infected individual.
Ho urged authorities to be on the alert for travellers from the 3 countries because the incubation period for the disease can be up to 21 days, and it's likely an infected person may not have any symptoms when they travel out of the country.
Because the incubation period after exposure to somebody who is infected by the virus to onset of symptom can be very long.
Ho also reminded the public not to travel to the 3 affected countries.
The Anti-Occupy Central campaign entered its 3rd week today with the launch of a website. The organisers celebrated with a bus tour and called on people to join their protest on the 17th of this month. Winner Wong reports.
The Alliance for Peace and Democracy officially launched the online version of their signature campaign today, 15 days after setting up booths on the streets. This morning, members of the Alliance, along with representatives from North Council, boarded a bus to mark the event. They hung banners with anti-central slogans and called on people to sign their petition. Started off at Fan Ling and drove past where the riders got off to mingle with supporters. According to the organizers, over the past 2 weeks, the web gained about 8,500 signatures since its launch at midnight last night. The petition ends on the 17th, the day the organizers have planned a street protest. Meanwhile, on Hong Kong Island, a dozen or so members of the Neo-Democrats marched from Admiralty to the government's offices at nearby Tamar. They're unhappy with the government's recently published political reform report, which used words like mainstream opinion to describe the support for a nominating committee to pick chief executive candidates. They say it's disrespectful for those who took part in an unofficial referendum and the July 1st rally. They handed in a petition to the government asking for civil nomination in the 2017 elections. Winna Wong, ATV News.
One of the city's top policemen says he doesn't have a problem with officers signing the Anti-Occupy Central petition.
With a growing number of officials, including the chief executive, openly supporting the Anti-Occupy Central campaign, some question whether the minister should express their political views.